Hi, this is Eric Durek for Med Health Fit Commentary. Our topic today is moving medical fitness to the next level. Over the past 30 years, fitness professionals have been working with people who've had medical conditions ever since the 1970s, but there really wasn't a lot of scientific information on either the safety or the efficacy of providing these types of exercise programs with people who've had many types of diseases. The 1980s, well, that was the decade where research in areas of cardiac rehab, diabetes, and obesity, and even orthopedics really started to expand. Within that decade, studies on exercise and cancer, the immune system, neurological diseases, aging, and pain management also increased. So, we now enter the era of medical fitness. With the expansion of hospital-based wellness centers and specialty health type centers, more types of programs are beginning to emerge. That said, the era of continuing education and safety have also come into being. The training programs should be containing information about the disease physiology and its pathology, and also designing quality exercise programs and delivering proper assessments, both at the beginning and at the end of each program. Over the past 2 decades, these exercise programs have been offered for special populations. It's really expanded probably exponentially. In the area of exercise and cancer alone, there are close to 10,000 certified instructors nationally, and probably more than 100,000 cancer survivors who have undergone some type of exercise and cancer training program. Recent research in sports medicine is also moving from the basic aerobic and training to higher intensity routines that follow specific work-to-rest ratios, use variations of weight training programs which we know improve the strength, the range of motion, and still have an impact on cardiovascular adaptations. So now there are tens of thousands of patients who are enrolled in specialty programs. So what are we going to do with all of that data? Data from assessments, data from biometric assessments, and data from the day-to-day training in exercise therapy sessions. And of course, what about the data from the follow-ups? Decades ago, and I'm sure even today, program notes are being written and stored in files in fitness centers all across the country and stored in some filing cabinet. But the rise of software programs, more and more trainers are detailing their information on their iPhones and their iPads. So how do we know how effective these programs are? Outside of reading journals and magazines in the fitness industry, what metrics do we have to let us know that our clients in the medical community know just how well these programs are doing? Well, in January of 2018, this year, Marshall and Groves published a paper in the American Journal of Lifestyle Medicine that actually looked at clinical outcomes and post-rehab programs in the health club setting. In this report, it looked at about 6 or 7 different components for 8 different medical conditions, and it concentrated on the pre and post assessments and a standardized exercise program for all of the subgroups. The results were perhaps the first research study that looked at clinical outcomes for many different types of medical populations since our work in the Cancer WellFit program from the 1990s, but that was one population group. The Marshall report should be considered the first in a series of outcome studies that collected in the industry from the newest form of analytic data, population health management. PHM is a new area of clinical research that looks at not only the medical aspects, but also things like cost containment, economics, and behavioral health, and also consumer satisfaction. Population health management may be looked at as the new form of epidemiology because it looks both at large population cohorts, but it also looks at different elements besides just clinical health. So how could population health work for your health and fitness location? Well, I'm assuming that most clubs use specific types of health assessments, HRAs, and biometric data. The challenge is how to compile all this information for all of the sessions, for all of the patients in your exercise programs. Most clubs still use paper files, as I've said, or a scheduling app to make sure that they're tracking some element of their client's information. The next phase we have here is to have outcome software to make data collection and analysis easy. Well, recently I spoke with a Louisiana company called Integrated Health Management Solutions, which is launching a new software program early in 2019 to help health clubs and medical fitness centers streamline their outcomes process to both collect and analyze data, but also to market these programs and outcomes to physician groups and health plans. It may be the most concise software in the industry, and in my opinion, not a moment too soon. Population health is the next big thing for medical fitness and health club industries. It serves a few purposes in that it can show a tremendous amount of improvement with regular exercise, even for persons with medical conditions. It can also compare the cost with other types of therapy services, and PHM is also instrumental in integrating classic exercise as part of healthcare. So for more information on population health, visit my website at medhealthfit.com. This is Eric Durack for MedHealthFit and MedHealthFit Commentary. Thanks for watching.